everyone and welcome to my channel. Well, if you are new here, this is Blackwood Pharmacology, and here we just talk about everything related to pharmacy, if it's the pharmacology part of it or the motivational part, the emotional part, anything that can help you to become a better pharmacist. That is what this channel is all about. And today I decided to talk about something very personal and quite dear to my heart, which will be acne, adult acne, and over-the-counter skincare products. Alright, one of the creams I use is a prescription strength, but the rest are all over-the-counter, so you can use it in your daily practice to help your patients achieve better outcomes before seeing a doctor or a dermatologist. So stay tuned and let's talk about adult acne. Okay, but first let me give you some background. I never struggled with acne as a kid, and then maybe in varsity around my third, fourth year the things started getting worse, but not as much that I wanted to specifically treat it. And then when I started working as an intern, my flare-ups began and I got mostly pastels and pimples, but also some cystic acne. My acne hasn't been so severe that I went to see a dermatologist for it yet, but it did take away some of my self-confidence, and especially in a new environment, working with people. Alright, so let's start with products. Now I feel if I teach you about the products I use, you can teach your patients and you can just get a better understanding and knowledge by explaining the products and how it helps with my skin. So the first thing I use is the Eucerin Dermo Purifying Oil Control. So it's a Eucerin face wash, and it actually has a good ingredient list. Nothing too harsh, nothing too. It has no actives in it, so it's basically just to clean the skin. So I will use this twice a day. It works good for me. The price is very good. It's a big container. It lasts a long time, so I would definitely recommend it. I haven't tried a lot of other products except for the Pimplex one, which I also tried, but I prefer the Eucerin over the Pimplex. As I say, it doesn't have any active ingredients in it, it's just to clean the skin. Alright, and then if I have makeup, I got this small taster from Dermalogica. It's a pre-cleanse and it helps to remove the makeup. One thing I am a bit concerned about this Dermalogica products is it has a very strong essential oils scent. So this one especially smells like tea tree oil, and that is sometimes irritating to my sensitive skin. But Dermalogica is very expensive, so I wouldn't say you need to have that to clean properly. What I also use to clean as an oil cleanser is the carrier oils, not the essential oils, the carrier oils. So one that I use now is the jojoba oil. Worked great, smelled nice, made my skin feel lovely, especially with Retin A cream that I'm using. But now I bought the organic rosehip oil, so I'm going to try this one as well. I've used it for a few days. It smells not as good as the jojoba, but it is still giving my skin a good feel and it looks good, so yeah. So if I use the oil to clean, I will first use oil and then I will use the Eucerin water-based wash. Alright, then at night I go in with a Benzac wash. Now Benzac wash is showing me much better results than using the Benzac ointment. Actually with the Benzac ointment, and I will share some photos of that, I got an extreme eczematic rash on my face. So it was just in the beginning of the corona pandemic, and I was treating some pimples here and there, and then I think together with the mask maybe it triggered something. But in the past I've also gotten a small rash of the Benzac ointment or the gel cream, but this here it was worse, so then I realized it's not as good for my skin. But the wash didn't do any bad reaction at all. Okay, then after I wash with those two at night, I will put in Retin A cream. I've been using this for quite some time. Last year I completed one full course of different. I think I didn't have so much knowledge in how to use the different. It made me very dry. I didn't like it, so I would stop it and try it again and stop it, which is not the best thing to do if you're using a vitamin A cream. The best is to continue for 6 weeks and see how your skin reacts to it. So with this here, I tried it again. I got myself Retin A cream, which is a first generation vitamin A, and I also paired it with a very good moisturizer this time, and it really helped me to stick to the regimen. Alright, after that Retin A cream, I will use a moisturizer. Now currently I'm using Sebamate Clear Face Gel. My skin is very dry, so this is not enough. So after this one I go in with whatever carrier oil that I'm using. Right now it's the rosehip oil, and it just feels wonderful to like hydrate your skin with that oils. So yeah, I just use that gel. I read about this one, Neutrogena Hydro Boost online. Had very good reviews, but it made my skin burn, so I'm unfortunately not using it. Okay, and that is the nighttime routine. So in the morning I will also wash my face with the Eucerin gel. Then I will apply the Dermalogica Salicylic Acid Overnight Clearing Gel. The reason why I bought it is very expensive in my opinion, but it's the only one I could find, and I really wanted to have like a good exfoliant on my skin. So it's been working well. It doesn't has any adverse effects. It looks like it's helping to clear up the acne. Yeah, so this one is expensive, but it's okay, it's good. And then after that clearing gel, I would go in with a moisturizer again, and again with an oil. I'm very dry. Then sunscreens. So the sunscreens I've tried is the Eucerin one, but this is a chemical sunscreen. It sometimes makes small crumbs on my face, which I don't like, so I'm not using it as much, not every day at least. I also tried the tinted one. Also, I don't like it as much. It's not bad, it just makes my skin texture not well, and it will like give off some small crumbs, as I say. So the one I've been trying now is the Cetaphil. It's a moisturizer and a sunscreen in one. It's very good. It goes well on the skin, doesn't leave any like casts and so on, but it does burn my face when I use the Retin A. So I'm looking for something else, but I'm still currently using it, continuing with it. And then I'm actually looking for a good mineral sunscreen. So I tried this Acne cream, or this Acne sunscreen. Now it's very pink, so I have to mix it with foundation if I want to use it, but it's okay. It's been working for me. Feels good on the skin at least, but it does leave me totally pink, and also it makes my face very shiny. So I tried to pair it with some foundation and then dab on some powder. Although I don't like adding makeup to my face, it feels like it makes my acne worse. I don't know if it's a mental thing, but yeah, I just want to go natural. I'm also not too shy of the acne, because it's a disease, but it also has taught me a lot. It taught me to care for my skin. So I try to be thankful for the opportunity to have acne, to learn more, and I don't want to necessarily hide it. I want rather to help other people to combat it. So today I went into Dermalogica. I like the company, I like the brand, it's just very expensive. But and I asked for them, don't they have for me a taster of their physical sunscreen? And the lady was so kind, she gave me one. And I just tried it today, and it works marvelous. But yeah, it's 1,000 Rand for, I think, a small bottle. So I will think about that, but I don't think I'm gonna buy it. But it is a good one, I must say. Best physical sunscreen I've ever seen. Yes, and that is my skincare routine. So I hope you guys learned something. I hope you can take some of this advice to give to the patients, because that's where they start. They all start with, my child has a pimple, please pharmacist help me. And I think this is a market where we can flourish as pharmacists. As I said previously, wound care, we can help them. Skincare, over-the-counter products, we can really assist them to make good choices. If I can also include, I use this very cool website. It's called which I will link down below. And then I would use it to take a picture of the product's ingredient list, and scan it into the website, and it will give me a profile for that product regarding the comedogenicity and the irritancy of the product, and it will rate it. So I think it starts with a 0 and it goes up to a 5 or so. But then before I buy something, I first check it there, and if it's have a good rating, I try it out. If it doesn't, ask someone no, just leave it. It's not going to work. Yeah, And then also what I think is what helped me is to make peace with my acne and not to compare my skin to other people and not to compare it to the ads I see on TV. Make peace with my spots, they are part of me, and maybe, yes, it is because I'm maybe overstressed or overworked, but it means that I have a job that's stressful, and that means it's worth something. So it's not always bad to have it, although it's not always nice. And yeah, so I'm seeing a dermatologist regarding the spots that I have, like just the hyperpigmentation, and I'm gonna share with you my experience there. It's just like, it's not as severe, but I would like to know what an expert would recommend for me, so I will share with you that advice that he gives me. And if you want to know, like, I'm definitely going to try out some new products. I'm not happy with the moisturizer, totally, and I'm not happy with the physical sunscreen I have. So if you want to have like an update, if I find a better product, please leave me a comment down and I will gladly share it with you. And that's all for today. You guys all be happy pharmacists. Bye!